So what is measles? What are the symptoms and what are the consequences of getting it?
Well, measles is an extremely contagious virus. It's a virus, and it's one of the most contagious viruses that we have out there, even more contagious than COVID-19, the flu, polio. I mean, you name it, it's probably more contagious than that virus. It can spread very easily. If you're sitting in a room where there's measles circulating and you're not vaccinated, you have a 90% chance of getting infected. Common symptoms are like those of the common cold, really, for most people. Things like fever, sore throat, cough, watery red eyes. But in a subset of people, it can really lead to more severe and devastating symptoms. Things like pneumonia, for example, which is infection of the lung, encephalitis, which is swelling of the brain, even deafness and blindness, and of course, for some people, death, right? 3 people have died already from the measles outbreaks here that are spreading across America. So definitely devastating and important disease for us to look at.
And how is it treated if you do get it?
There's not much direct treatment for measles. Treatment is very supportive. Really the way we try to go about treating it is by preventing it to begin with vaccines. So, the vaccine is extremely effective at combating measles, for example. Typically, people get 2 shots of the vaccine. They get it when they're 12 to 15 months of age, and then they get a second shot when they're 4 to 6 years of age. And even getting 1 shot of that vaccine offers you 93% protection against the virus. And if you get 2 shots, like most of us do, you're 97% protected against getting it. So that essentially means you're more or less not going to get measles if you have 2 shots of the vaccine. Now, if you were to get it and you're not vaccinated, treatment is mainly supportive, giving fluids, making sure that you control pain, control the symptoms and things like that. There's nothing really direct that if you were to get it, is able to kill and tackle the virus, head on.
Kind of like the early days of COVID-19 before we had things like Paxlovid that you just kind of tried to make them feel better while they had it.
That's right. That's right, Jeremy.
So the vaccine that we get for this is the MMR vaccine, which is measles, mumps, rubella. This is what we get as kids, as you say, two shots, but years apart.
That's right. Yeah. So one is when you're pretty much 1 year old, 12 to 15 years of age, and then you get another one when you're about 5 years old, 4 to 6. This is part of the childhood vaccination schedule that most people get, and often a lot of schools require you to get. So you may have gotten it just as part of, having to go to school. When you go to public school, you have to show proof of vaccinations. MMR is one of those vaccines that, you have to show proof for before you can enter public schools.
And more than 90% of Americans right now, I think, are vaccinated in some way.
The rate that I've seen lately, I think, is like 92.7 or 92.3%, which you would think is good, but unfortunately, it's not good enough, Jeremy, because, measles vaccine really requires a herd immunity rate of 95%. So what that means is, Jeremy, herd immunity is the immunity that's conferred, or the protection that's conferred upon a general population when a certain percentage of the population is vaccinated. So for measles, that ends up being 95% because it's so contagious. We need to have a rate that high to protect the entire population. So the fact that this rate now is 92%, that's below, the 95% threshold that we need. And in some communities, like in Texas, where measles is surging, that rate is well below that. It's like 82% or 83% in some communities in Texas. So this is also why measles is spreading very rapidly.
And it started in this latest outbreak, and you talk about Texas. It started in a Mennonite community, which I'm thinking not very vaccinated population. Just as in 2019, when there was an outbreak, it started in a Orthodox Jewish community in New York, where obviously low rates of vaccination or no vaccination. What do we know about the outbreaks that we're seeing right now? Are they all connected to the Texas cases, or are they just popping up in various parts of the country?
They're not all connected to the Texas cases. The epicenter we know is in Texas and New Mexico. That's where the vast majority, we have over 1,300 cases now in the United States, and 750 to 800 are just in that population, Texas/New Mexico. And all the deaths have occurred in that population, 2 childhood deaths and 1 adult death. But what we also know, and I think the most important thing to know here, Jeremy, is that the vast majority of these cases are in unvaccinated individuals. 92% of these cases throughout America, I'm not just talking about Texas, but throughout America, are either in unvaccinated cases or in cases that we don't know their vaccination status. So this is a disease of unvaccinated individuals. I mean, let's just be clear and simple about it. This is occurring because vaccination rates have declined, and parents are not choosing to vaccinate their children.
There are those some cases that are happening in people who are vaccinated. Is that just sort of because the vaccine is not 100% effective?
That's right. That's part of it, Jeremy. So part of it is that no vaccine is perfect. I mean, MMR is close to perfect as we get. I mean, 97% protection. You can't say that for many other vaccines. You can't say that for the flu vaccine. I mean, I don't even think you can say that for the COVID vaccine. But for MMR, it's honestly one of the best vaccines that we have in public health. 97% protection. So obviously it's not 100%. So some people are going to still get infected. The other thing is that immunity does wane over time, right? I mean, everyone naturally, it wanes. I mean, it doesn't wane as much for measles, honestly, because the vaccine is just so powerful and it's very effective at preventing disease, but it does wane. And the other aspect of this is that when there's a high rate of measles viral activity in the community, as potentially there is in Texas and New Mexico, that can overwhelm the immune system. And that can often make you somewhat more susceptible to getting the virus. So this is also why we're seeing some of the cases. And also, we have to talk about people that have weakened immune systems to begin with. People like infants whose immune system is not developed properly, elder people with chronic conditions who are more likely to get it, and they can often get this. So this is why, part of the reason why we're seeing some of the new rates, and part of the reason why sometimes vaccinated individuals, although rare, can often get the infection.
Before the vaccination, it sounds like everyone got measles, kids got measles, and hundreds of kids would die each year because of it.
Mm-hmm. That's right. So before 1957, measles was endemic. I mean, it was widespread in America. People got it, people died. And then honestly, even if, the CDC recommends that if you were born before 1957, there's no need for you to even get the vaccine because you're likely immune to measles because it was so widespread. But then things changed when we, started to give the vaccine, and now we must get the vaccine in order to keep and stay protected.
So one of the things that I've read about this is that experts like you see measles cases as a canary in a coal mine for other preventable diseases, that if we start seeing this, we're going to start seeing other things. Is that just because people who are unvaccinated for this might be unvaccinated for something else, or do measles cases end up leading to other things that are then going to spread on their own among the population?
Partly both, Jeremy. Let me explain what I mean by that. So the major reason is well, first of all, this is already happening to other diseases. If you take a look at whooping cough, for example, that's also very preventable. But we're seeing thousands of new cases every year in America because people aren't deciding to get vaccinated, right? So the DTaP vaccine prevents against whooping cough. So this vaccine hesitancy, this increased vaccine hesitancy where people are hesitant to vaccinate their children is leading to the resurgence of preventable infectious diseases, among which is measles, among which is whooping cough. But part of it also is measles. Measles is a really deadly and dangerous virus. So what it does is it can attack some of your immune cells. It can attack your T cells, which are part of your immune defense mechanism that help prevent infectious diseases. And that can wipe out your immune memory. I mean, this is one of the only viruses that does this. And then it can allow you or prevent you from attacking and warding off other viruses that come. I mean, seriously, this is what happened. This is what research has shown. So this is why it's particularly important to get vaccinated with measles. But, really, the reason why we're seeing all the resurgence of all these other viruses is because of misinformation and vaccine hesitancy. People don't really understand the importance of vaccines, the efficacy of vaccines. There's a lot of not truths about vaccines, and people are not vaccinating, and people are getting scared to vaccinate. People think that these vaccines can harm them when, in fact, these are responsible for saving a lot of lives.
So the CDC says that vaccination is the most effective way to prevent measles, but that a vaccine is a personal choice. Is that not a strong enough statement for you?
It's not, because it's a new statement. It's a statement that's been made by our new Secretary of Health and Human Services, Robert F. Kennedy Jr. Of course, getting vaccinated is a personal choice. I mean, no one can force you to get vaccinated. I mean, if you And we know that here in America, right? I mean, if a parent doesn't want to vaccinate their child, they don't have to. By all means, they don't have to. But I would hope that the message is a little bit more clear and stronger and profound, particularly with what's going on here. I mean, now, for the first time, we have more cases of measles for the last 33 years. We're at risk of losing our World Health Organization elimination status because of continuous transmission now for about 7 months. If it happens for more than 12 months, we will lose this elimination status. Like in 2026, if this continues till December, January, it will no longer be eradicated here. So this is a problem, definitely, no doubt, here in America. And, I would wish that the messaging was a little bit more clear, a little bit more bold in stating that, this is the only way to prevent measles. And you should get vaccinated. I think that's the message that I would hope to hear. And I think that's what public health experts and public health officials would want for communities, to ensure that everyone is safe.
So this is what Robert F. Kennedy Jr. said on Fox News in the spring. Quote, "There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself cause, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves." When you hear that, it does sound like he is not encouraging, but discouraging people from getting vaccinated for measles.
It's very discouraging. And of course, if I didn't know any better, I probably wouldn't vaccinate my kids either. But everything he said is false. And I think you have to understand that it's simply not true. The vaccine is extremely safe. It's extremely effective. I mean, side effects from the vaccine would be things like, pain at the injection site, maybe a rash that would go away in 1 or 2 days, redness in the area, certainly not blindness, deafness, or any of the more serious things that he's talking about. It's just, the data doesn't support that. There's nothing in science that supports what he is saying. And in fact, it's the opposite. It prevents those things. It prevents you from getting infected. It prevents you from ultimately getting these devastating consequences like deafness and blindness. And this is the misinformation I'm talking about. The misinformation is coming from the top, unfortunately, and it's causing vaccine hesitancy, and people are more and more skeptical to get vaccinated. And then what happens is that we start to get measles surges, and we start to see things that we haven't seen in over decades. So it's very concerning, and this misinformation epidemic is fueling many of these cases that we're seeing throughout America.
Well, and the Wall Street Journal editorial board, which is quite friendly to President Trump in general, wrote about this and criticized Kennedy for saying that, but said liberals' criticism of Mr. Kennedy for spreading misinformation might carry more weight with the public if they hadn't made the same criticism against the opponents of COVID lockdowns. What do you think about that? The attack that is coming from the right on this, that, well, people like you and experts don't have a leg to stand on because they thought we should be wearing masks and locking down during COVID-19.
It's unfortunate, when people start to politicize certain things. We can only speak about the facts and what we know and the best evidence at the time. COVID-19, I mean, regardless of what you want to say about how things were handled, and I don't believe things were handled 100% effectively during the COVID-19 pandemic, but vaccines do save lives. I mean, if we look at the COVID-19 vaccine, despite it being a very polarized topic and people talking about, whether people should have gotten vaccinated, should there have been vaccine mandates, research shows that it saved over 13, 14 million lives. I mean, that's a fact in research, right? Masking, although people may not want to do it, it does decrease the spread of infectious diseases. So based on the information that public health experts had at the time, these were the best things to do. So to equate the measles and how we're dealing with measles and the vaccine with things that happen in COVID, I think is unfair. I think it doesn't rely on evidence. And, in public health, we rely on evidence. We rely on sound evidence, what the data shows that can help and protect the public. And we know that the measles, especially measles, we're talking about a vaccine that is 97% effective. That should be the message. The message should be getting vaccinated will essentially protect your kid for life from getting measles in their lifetime.
Is it possible to rebuild trust among the people who lost trust in the health experts because of COVID-19?
It is, but it's going to take time, Jeremy. I mean, nothing is going to happen overnight. We have to be a little bit more vigilant in our messaging. I think the data needs to be stressed. The data doesn't lie, Jeremy. I mean, you put numbers there. I mean, this measles outbreak is a perfect example. There are 1,300 outbreaks 1,300 cases, excuse me, of measles here in America. 92% are in unvaccinated individuals. I mean, what does that tell you? That tells you that people who aren't getting the vaccine are the ones that are suffering. They're the ones that have these symptoms. They're the ones that are at risk for having these complications. They are the risk for dying. All 3 individuals that have died, guess what? They were unvaccinated, right? There hasn't been a single person that got vaccinated that has died from measles currently in this outbreak that we're seeing in America. So the numbers don't lie, Jeremy. So I think we have to really be clear about what the data, and then also be willing to have transparent conversations. Instead of attacking one side or the other, why can't we all just sit and talk about this, in a very nonpartisan way, similar to what we're doing here? I think that's why I think this is great, to talk about this in a very nonpartisan way. Just talk about the facts. Have people on both sides. I would love to sit there and talk to Robert F. Kennedy in a chat or something and just discuss. I mean, that would be excellent. I think that would be great for the country, to have other public health experts talk to him and see what his concerns are, so that people just really understand what's at stake here.
There's an article in Time magazine about Kennedy and some of the other things that he has been doing. Just to remind our listeners, he removed all 17 members from a CDC vaccine advisory committee and put several members on there who have been vaccine skeptics like him. The new committee met a few weeks later. It voted to stop recommending flu shots that contain an additive that the anti-vaccine movement has attacked for years, despite no evidence that it causes problems. And the committee also said it's going to review other childhood immunizations. Are you worried about this new panel? I mean, could this have a real impact on the health of the country?
Well, it's going to certainly have a huge impact on the health of the country, because this ACIP committee that you're talking about sets the childhood vaccination schedule. So they can do whatever they want, essentially. And, Secretary Kennedy has picked and tapped the people that align more or less with his views, which are, skeptical for vaccines. So my fear is that we will start to see vaccines not recommended, or not recommended as robustly as they have in the past. So yes, this will be a major problem, and we're going to start to see the ramifications of this. There should really be, I think, a more balanced viewpoints that are represented, not just those who oppose vaccines. If you talk about, what you're talking about is thimerosal, which is a mercury-based derivative in flu vaccines, and research has shown that there's no harm in that in the concentrations that are given in those flu vaccines. And in fact, thimerosal prevents multi-dose vials from getting contaminated from fungi and other bacteria. So that's the reason why they put it in there. But it's only in 4% of flu vaccine, constituents. So it's not like it's the vast majority of those flu shots don't even contain it. So I think what this does is this undermines science, this undermines evidence, this undermines trust, and this creates even more fear and more hesitancy in vaccines. So I believe it's unfortunate. This is my opinion. I believe it's unfortunate this is occurring, and I don't believe this is going to restore trust in science or in vaccines based on what's already currently happening.
Okay, just to give some context here, the United States is not the only country that is dealing with a surge in cases of measles. It's happening in Mexico, in Canada, and other places. Is that for the same reasons, just vaccine skepticism in other countries?
For the most part, yes, it is. So we're talking about social media, right? Social media travels faster than a virus, Jeremy, right? So you post something on social media, I post something, everyone in the world can see it. So this vaccine skepticism, this misinformation that we talked about is not just in America. I mean, in Europe, we're seeing, cases of measles in pretty much all around the world. And because people have access to social media, people have access to X, to Instagram, to all of these various platforms where people are spreading some of this misinformation, and people are trusting some of this from non-experts. But, there are even doctors that say this type of stuff. There are quote unquote experts who are saying that, vaccines may not be safe or effective, or they may be saying that, vaccines can cause harm. So that causes pause to people that don't understand this at a high level, Jeremy, right? So, and understandably so, if I'm to put myself in those shoes, if I wasn't a physician, I wasn't a public health expert, it would probably give me pause too. I'd be like, oh my God, wow, I have 4 kids. Should I be vaccinating my kids? I mean, this is what I'm reading. So many people are saying this now. There may be an anecdotal 1 or 2 examples of this maybe I shouldn't do it either. So you can see the rippling effect this can have. And, very easy for people that, want to do well for their kids, so it's unfortunate. It's unfortunate that this misinformation spreads very rapidly, particularly with social media.
Okay, final question to you, just for our listeners who are like, well, I'm vaccinated. I feel like I should be fine. Are they? Is there anything that vaccinated people need to do because of these measles cases?
For the most part, if you're vaccinated, particularly against measles, you should be fine. I mean, 97% protection is 97%. The other things are try to avoid overcrowded areas. If you're in an area like Texas, for example, where measles is circulating at a high rate, potentially consider wearing a mask. But the vaccine is very good. It's literally one of our best vaccines in public health. So I think if you've gotten 2 shots of the vaccine, you've done your part. You've done your part in protecting yourself. Part of the reason we also get vaccinated is to protect other people. So those that can't protect themselves, elder people that have, weakened immune systems, infants who don't have or can't get the shot and they don't have developed immune systems. So that's why it's so critical. But, just being vigilant and making sure that you're in safe areas and to get vaccinated, you should be good.